It's supposed to be the place you can rely on for care 24 hours a day, 7 days a week. But Ontario emergency rooms are under unprecedented pressure. And this long weekend, more than a dozen hospitals had to close their ERs, beds, and ICUs. Frontliners say COVID has stressed cracks in the foundation of a system already on the verge of collapse.
I didn't expect it to be quick. It's an emergency room.
After walking into Michael Garron Hospital back in May, Emma O'Neill waited more than an hour just to be registered as a patient. She spent another 2 hours in the ER before seeing a doctor.
As frustrating as it was, I felt really bad for the staff. They were completely overwhelmed.
Wait times have never been longer. The latest figures from Health Quality Ontario show in the month of May, patients waited on average 2.1 hours for a first assessment by a doctor in emergency. The average wait time to get admitted to hospital was 20.1 hours, the highest on record.
People who are sick and need to be admitted have nowhere to go, and we don't have people to take care of them either.
Dr. David Carr says we have a lack of beds and nurses to staff the beds we do have.
I, Sylvia Jones.
The new Minister of Health, appointed to the job in June, has yet to speak publicly, prompting the NDP to issue this statement with a single question: where is Sylvia Jones? Her office says since the start of the pandemic, we have added more than 10,500 healthcare workers, adding the province is working with hospitals and unions to address the challenge of maintaining the required staffing levels, a problem that predates the pandemic but has been exacerbated by it.
Ontario has incredibly low hospital and ICU beds per capita. Ending hallway medicine, it's now we've moved towards ending waiting room medicine.
This goes far beyond the waiting room. Almost every part of the hospital is operating short-staffed.
The emergency departments are in a crisis, but we're sort of just the canary in the coal mine.
At St. Michael's, emergency department volumes are close to pre-pandemic levels. But Dr. Andrew Petrosoniak says he sees fewer patients every shift. It's not surprising.
Patients have, greater degree of complexity. They haven't received the care that they've needed over the last few years.
That's increased the amount of time and effort to care for each patient. Not to mention, COVID-related changes have made every task more time-consuming. Another challenge is not having a unified electronic medical record system, often leading to repeat tests and procedures.
If every patient takes a little bit longer, of an extra 2 minutes, that adds up.
And when every minute counts, Carr says a delay in your care could be detrimental.
Patients are being harmed by lengthy delays.
Ontario's patient ombudsman tells CityNews it has seen an increase in calls and written complaints about ER wait times and triage, but they still only make up a small proportion of total complaints that the office receives. Caryn Ceolin, CityNews.